Hi, I'm Jodie Ann Senior. I'm a cardiologist and heart failure specialist, and today we are asking the question, what is the role of diet in heart failure anyway? So you have heart failure and you think, well, surely I just have to take my medications and I'll be fine, won't I? Or you wonder that there might be something else that you need to do. Perhaps you feel stuck with just taking the medications that your doctor's prescribed and you don't feel like that's actually enough, but you wish you had some power to be doing more to help yourself, but have no idea what that should be. Here is where we are going to discuss the power of diet and its role in heart failure and some of the elements. So, heart failure is actually a description of a syndrome. It's a constellation of symptoms, a cluster if you like. So it tends to be things commonly like shortness of breath, swelling in your feet or legs, maybe your belly, even your hands, right up to the thighs. It could even involve lower pelvic area. It might result in other things like palpitations, dizziness, lightheadedness, fatigue, maybe even chest discomfort, possibly even passing out. Essentially, the reason that this happens is because the heart, which is an organ that pumps the blood around the body to the other organs, is there in order to help them operate properly. This, in simple terms, means that the heart fails to pump enough blood forward to the organs. And this can create some back pressure, which might create fluid seeping into those organs or tissues to make them somewhat kind of swollen and heavy. And this means that they don't do their job properly. They aren't operating efficiently, and therefore it makes activity quite challenging. So, you might rightly wonder, what has any of this to do with the things that we eat and drink? What evidence is there for diet and a role in heart failure prevention or improvement of the symptoms and outcomes in heart failure? Indeed, this is a very tricky area since we aren't lab rats with a strictly controlled and prescribed diet. And this makes us very, very difficult to study when it comes to all the variances in our lifestyle, habits, and preferences. And then it's quite challenging to find the evidence at the level that we doctors like to have to be able to say confidently, you should do this. So this is pretty tough when it comes to heart failure and other areas of health and well-being or disease. It makes it very hard to be emphatic about it. But we've attempted to come up with guidelines based on what we do have in terms of research and observation. And thus far, we are doing the best we can to look at those things in terms of how they affect our patients. I'm a huge believer in the one thing that I have witnessed in my patients time and time again. Medications or drugs might give you a clear-cut benefit, but with that anticipated benefit come the potential string of downsides or adverse reactions, commonly known as side effects. A side effect, as you would think, is something that happens alongside the wanted effect but isn't necessarily a good thing. Whereas when you make a change in your lifestyle for the better, then you may anticipate a certain positive effect, but in actual fact, you won't just see potentially one positive effect. You are likely to see a broader string of positives that then result in your life from that change. For example, you cut out alcohol because your doctor says you need to cut out alcohol, you're getting fatty liver, and you want to avoid getting cirrhosis of the liver, which is a very serious condition where your liver fails. So, after cutting it out, you notice you lose some weight. You start thinking a bit more clearly. You sleep a bit better. Your partner finds you're less moody and depressed, and you spend more quality time with them. And maybe now you feel like going for a walk or exercising, and you're not spending as much time sitting around on the couch or out the back by the barbecue drinking. This then improves your fitness, etc., etc. Life looks impressively more positive than just that one single reason that you had to give it up. And in fact, when you've given it up for a reason like cirrhosis or liver failure or fatty liver, you probably don't even see or notice like what's going on in there. You can't see that result. You can definitely see a result if you get it scanned, but that's not an objective, or it is an objective thing, but it's not a subjective thing that you can notice the benefits of. But all those other things that I said, you can easily see or track in your life. That may in fact be significantly improved quality of life for you, perhaps even for other people around you. So for me, a lifestyle intervention is something that I fully believe is every bit as important as the medications you take. They both have their purpose and their benefits, but the implications for changing your behaviours can be much broader than for just the medications taken. Please always check with your own specialist for medical advice regarding any changes in diet or lifestyle, and make sure that they're safe for you. Now, in terms of what I thought might be useful, there's a few things out there. So for example, in December 2021, in the journal Nutrients, there was an article that was assessing dietary management of heart failure, in particular DASH diet and precision nutrition perspectives. Heart failure has a high cost both personally and to the public purse, because there are now millions of people across the globe that are suffering from this. The DASH diet that they speak of was designed to really look at dietary intervention for heart failure management with or without medication. DASH standing for Dietary Approach to Stop Hypertension. And it's really about nutritional interventions here, not just drugs. And I think if you are battling high blood pressure and you're on multiple drugs, then you start getting into side effect territories or running out of options. And the medications are only one aspect of how you look after yourself with regards to high blood pressure. Again, same with heart failure. So they're looking to for efficacy for this dietary intervention to decrease risk factors, improve health beyond the actual risk factor modified. And in fact, dietary interventions can alter cholesterol, it can lower blood pressure, it can improve diabetes control. It can then flow on to reducing risks in heart failure itself. Diet affects the amount of salt and water that you might retain. So again, that's a benefit in heart failure. And these things can then result in less hospitalisation and better quality of life. As after all, this is what we all want. We want good quality of life whilst we're around. So benefit of diet versus benefit of medications, they both are important. They both have advantages. I'm not suggesting for a second that you should just ditch all your pills and go for diet alone, but I think done in conjunction with each other might mean you even need less medications than if you didn't. So what do we do about salt? We did talk about that on a previous video, but just to give a little bit more detail here, don't add salt to your food if you can avoid it, because there's a fair bit of salt in processed foods, and the recommendation for salt in our diets per day is probably around 1.5 to 3 grams of sodium a day. Now this is sodium. When we talk about salt, we're not talking about potassium or magnesium, we're not talking about calcium or other elements, we're talking about sodium. Looking at your nutritional information guides on the packets will help, but I've got a better idea. Don't eat anything that you have to look at the nutritional advice on. What does that mean? Well, the lowest salt foods tend to be things like plant-based foods, whole foods, fresh foods, vegetables, fruit, non-processed meats, so your beef, chicken, eggs, low salted cheese like ricotta, for example, mozzarella. These things tend to have lower salt content. So if you're eating more of those types of foods rather than processed foods or hyperpalatable foods, those tasty things that aren't very good for us with high fat content, high salt content, high sugar content, we're going to do better. Now, if you need to look up tables, I actually found this quite challenging. I found it really hard to just get advice on the internet that helped me understand what does 1.5 grams of sodium look like. I found it easier to look up things that gave me, what are low sodium foods or what are high sodium foods. Apparently, the average American consumes 20 times the salt necessary for their body each day. This has a very profound impact on water retention in heart failure and blood pressure. So this is something that really needs to be looked at and corrected. And when you're looking at what types of foods to eat or avoid, try and avoid, if you're again going for whole foods, there are a few things that you want to definitely think about. The fresh foods are really the better things. So even when it comes to, say, fish or chicken or meat, avoid canned products where they add salt or using particularly salty foods in the first place, like sardines, caviar, or anchovies, for example. You could have a tiny little bit amount as long as you're not overeating these things. Look at their content for, say, smoked foods, canned meats. Something like Spam would not be great. Frozen dinners, also higher content of salt. Pizza, takeout, chips, Chinese, Japanese food, these often have very high salt levels. Salted nuts, chips, and the like, biscuits, savoury biscuits especially, high salt content. Canned beans can be, so you need to be careful of those sorts of things as well. What are low salt things that you could consume? You can have eggs, low salt dairy, unprocessed meats, beef, lamb, pork, chicken, turkey, fish, but not your processed versions of that, not your salamis, mortadellas, lunch meats, that kind of thing. Try and avoid that sort of things. Those yummy salami, other meats, can't think off the top of my head, but you know what I'm saying. Don't go to the deli, because the deli, unless it's, just don't do that. You got to be careful also with some cheeses, even buttermilk. Lower alternatives might be the ricotta mortadella. You've got to be careful with certain breads. If you make your own bread, at least you can control how much salt goes in the bread mix. But if you're getting pre-fabbed, pre-made up bread mixes, or you're buying bread, some countries the salt contents are much higher in the breads consumed than others. They'll surprisingly add salt and sugar, so there's a few things to watch there. Check sauces, because sauces can be a trick. Soy sauce, Worcestershire sauce, very high in salt. Tomato sauce, sugar and salt. and chili sauce, things like that, oyster, any of those Asian or fish sauces can be really high in salt. So if you're going to use that, please only use very, very small amounts. Better to avoid them if you can. Substitute salt for great herbs, for example, because you can get flavour without necessarily adding the salt. And I know most of us like the salt and we're used to it, but you can easily adapt your taste buds to other alternatives. There is a little bit of a movement to try and get potassium-based salt additives rather than sodium-based. You have to be careful with that one too, because you have to check with your doctor about whether potassium is a problem for you. So please just don't think, yes, you can switch from one to the other and that'll be fine. Think about salad dressings, mayo, butters when they've added salt, desserts, all that sort of thing. The desserts, you wouldn't even think that they add salt, but we all like the salted caramel. Well, many of us anyway. I know I do. Salted caramel is called salted caramel because they add salt to increase and enhance the flavour of the sweetness. So that's a bit of a trick. So going back to what is the DASH diet consist of, it's more whole grains, fruit, vegetables, low-fat dairy, lean meats, poultry, nuts, be careful with salted nuts, seeds, legumes, minimum use of salty foods, fats and refined oils, high in fibre and whole foods. I try and keep that simple and say try not to get something that's processed or has ingredients. Try and get it fresh and get it from the original sources rather than in a supermarket if you can. So if it comes out of the sea or a lake, or if it's out of the ground, off a tree, from your paddock, roughly speaking, this is the way to go. You definitely want to avoid the ultra-processed, hyper-palatable foods because they will be high in saturated fat, high in salt, high in sugar, and these things are very bad for blood pressure, diabetes, weight gain. All these things will challenge the heart failure situation and make it potentially worse. So how might changing your diet improve things? Well, certainly by reducing salt intake, you're going to reduce the water retained and therefore improve the symptoms of fluid retention, that shortness of breath, not being able to lie down because you're short of breath, the amount of swelling in your legs, the water retained by your body, the feeling of bloatedness, all of those things. So definitely this helps controlling that side of thing. Also, the more salt you eat, the thirstier you'll get. That means you're likely to go over your fluid restriction. This is a big problem for heart failure patients and really something to avoid. There are some other potential benefits. The more you stay away from processed food and eat whole foods, lower in salt and sugar, etc., you will likely have a less inflammatory environment because there's less stimulus for the cytokines or chemicals in the body that are pro-inflammatory. There's eating foods rich in antioxidants would presumably help with free radicals and the metabolism of nutrients. And definitely you don't want to be in a malnourished state. There are plenty of people who eat a lot of calories, but they're poor quality calories. They're not providing good nutrients to sustain you, to give you energy, to fuel your organs. Think of it this way. If you're a guy and you have a fancy car like a Ferrari and you are wanting to show that off to your mates, you aren't going to put poor quality fuel in that Ferrari. Well, I can tell you, if you're a patient and you think it's a good idea to eat garbage fuel for your body and then expect it to run like a Ferrari, that isn't going to happen. So you've got to treat your body like it's a world-class car and that you are going to provide the proper nutrients for that car to run like that first class vehicle that it is, rather than some bomb that's barely going to make it down the road. Okay? So that's how I want you to think of it. Your body is like that car. You've got to fuel it properly. Otherwise, you're going to end up in big trouble. So, lower salt diet can achieve even as much as a 5 to 7 millimeter drop in blood pressure, systolic blood pressure in patients with high blood pressure. And this can help prevent the progression to heart failure, which, especially in patients who are under 75 years of age. This was something that was looked at also in the multi-ethnic study of atherosclerosis and the effect on possibility of heart attack and stroke. There was a potential for decreasing the risk of stroke. Raising your dietary omega-3s or increasing the amount of fish or oily fish products that you eat has also been shown in a study to reduce recurrent hospitalizations for heart failure compared with placebo. So, I mean, that is actually something I hadn't heard until recently. So another good reason to take your omega-3s or increase your intake of fresh fish. In another study that was published in the Journal of American Cardiology in 2021 was a study where they looked at the effects of diet and sodium reduction on cardiac biomarkers of injury. So what they did was they looked firstly at DASH diet. DASH diet reduced the biomarkers of cardiac injury. What are they and what's the point of that? Reducing making it more a whole foods diet caused the markers of heart damage that are really, really subtle in our blood and can show like tiny little bits of injury. The high sensitivity troponin, they actually reduced when the diet was improved. And let me also say this, when you change your diet, the effects of that benefit can happen very, very quickly over hours, days, weeks. Whereas, some other effects might take years to happen. When you reduce your salt intake, this reduced the cardiac stress showing up as a reduced NT-proBNP. So what is that? The NT-proBNP is a cardiac biomarker that looks at the stress of the heart related to pressure and potential for fluid in the lungs and the symptom of pulmonary edema or breathlessness. And this was reduced, and this is a significant biomarker in terms of heart failure patients and outcomes. When they did both DASH diet with salt reduction, there was a 20% reduction in high sensitivity troponin. Remember, that's the biomarker looking at actual cell damage. It's a microscopic cell damage in the heart. And this is seen in heart failure patients even without heart attack, but it's also an early marker for heart attacks in certain populations as well. And a 23% reduction in the NT-proBNP marker, which was the heart failure marker, the one that looks at pressure and fluid potential for the heart and lungs. So these were very, very significant. There's a study also known as the gourmet heart failure study that looked at DASH diet via home delivery of meals. So again, going back to that whole lab rat scenario, we're not very good at following prescribed diets, but they felt that if they set up a situation where they're actually delivering the meals to the patients and monitoring that, they had a better chance of compliance because those meals were already prepared, done properly, and supplied to the patients. And in that study where they did that meal delivery, there was a reduction in symptoms of heart failure. There was a reduction of physical limitation, so improvement in their exertion tolerance, and a decreased risk for hospitalisation just from changing their diets, which I think is a very significant thing. We obviously have to remind ourselves as human beings that poor adherence is a significant contributor to high hospitalisation rates, especially with heart failure. Compliance to medications, we know from many studies, is routinely fairly poor. In some cases, the compliance to taking the medications that the doctor has prescribed might only be 25 to 30%. We also have to factor in things like affordability of those medications. There are lots of people in lots of countries that struggle to be able to afford the heart failure medications, but here's some way you could intervene at a much lower cost. Everyone has to eat, and okay, what you eat, how well you eat might be debatable, and cost may vary. However, often the healthier fresh foods from local markets or environment are cheaper than buying many takeouts, processed foods. Not always, I grant, but I think that in most cases it is doable if you are careful. So then there's the whole complications around adhering to diet or fluid restriction, and not adhering to diet and fluid restriction in particular accounts for a very significant proportion of hospitalizations for heart failure. So getting that fluid restriction right, which I've talked about in other episodes, is key, but getting the diet along with that is also important. So we've talked about fluid restriction, we've now talked about salt, we've talked about whole foods and high fiber, low ultra processed foods as the basis for a good healthy diet. I think that what you can do for yourself in terms of diet makes a very significant and important difference to how life works out for you with your illness. You don't have to be a victim to your disease. Sugar and processed foods, again, high carb diets, the high processed carbohydrate diets, I should specify, not your fruit and veg. You're not going to get fat eating a lot of apples because you just won't be able to do it because they have a high fiber content. Same with oranges, same with celery, same with zucchini, same with salad. You aren't going to get overweight. You aren't going to retain a whole heap of water and salt from it. So eat some fresh food. Choose that over other things. Even, your avocados. Just making real food is really important. Sugar as an aspect to this and processed carbohydrates are going to increase your water retention. They're also going to play havoc with your diabetes if you are diabetic, or lead to diabetes if you aren't yet diabetic. This will have a further ramification of making you retain more water and worsening your heart failure. It's also likely that it's going to cause you to gain weight. When you gain weight, you make it harder for your body to do just about anything. Even with healthy lungs and heart, everything is going to be much harder because it's kind of like carrying around, 6 bags of extra oranges and then trying to do normal stuff like walking around. Now, I'm not trying to be disparaging about people who are already there, but this goes to the point that it's really important to think about your diet and your weight and how you might be able to help yourself by eating a cleaner diet, getting leaner if it's possible, because this is going to make life so much easier for you. You're going to be able to do more, and we know that studies link doing more, or ability to do more, with better survival in heart failure and heart conditions, which obviously then leads on to exercise and rehab, which will be the conversation of the next topic. And then there's one other thing I think, people think, oh, okay, well, if I don't have sugar, is it okay for me to have the diet sodas and all those things? I would say personally, no. You're not teaching your brain anything if you are having the no sugar alternatives that are still really sweet. Your brain is going to think it's the same as sugar. It's going to keep looking for more sugar. It's going to keep hitting those dopamine centers, and you're going to keep looking for more food. That's, even aside from the negative effects of various chemical sweeteners. I think this is largely a bad idea. I don't want to get into the details of artificial sweeteners, but if you look, there's plenty of information out there on them. And I just think this is not a thing you should do. If you're going to have fluid, try and have water predominantly. Don't have juices or other sweetened beverages. Don't have the diet versions where you're having the chemicals. Have water. It's, your body is somewhere between 60 and 75, 80% water, depending on which bits you're talking about. But just water. It's what we drank before we had access to all these things. And there's a good reason for that. And finally, I think we need to just have a brief word on alcohol. Alcohol can cause cardiomyopathy. There are specifically people who've developed cardiomyopathy as a direct result of heavy alcohol consumption. For those people who've got cardiomyopathy related to their alcohol consumption, they should not drink it at all. They should completely abstain. If they don't, they're going to perpetuate their heart failure and their heart disease. That's just a sad fact. So if you can abstain, that's going to give you the best results at the end of the day. However, in my practice, I advise my patients who have cardiomyopathy and heart failure not to drink at all. Not because it caused their heart failure, because likely there's some other cause, but because alcohol, firstly, is a toxin to the myocardium or the muscle cells. We know that. It's likely further injuring the heart. Even if you discard that as an argument, alcohol is going to affect your metabolism of your medications. So if you also take that a step further and you're a patient who's got congestion in your liver, that metabolism is going to be further impaired by that congestion and the alcohol. You are just better not to drink. Now, do I care if you have one celebratory glass of champagne at your 20th wedding anniversary or your 45th birthday party? No, that is not a problem. The odd glass of something generally isn't going to be a problem as long as you are pretty careful. But what I'm saying is, don't make it a habit to drink alcohol. This is something that I ask of all my patients. Whether they do that or not is obviously up to them, but here's the point of this whole video series. This is here to help you do the very best you can for your own health and get the greatest likelihood of good quality of life, the ability, even with a sick heart, to do all the things that you want to do. Maybe not run a marathon perhaps, but most of the things that you want to do in life, to have reasonable quality of life where you're free of breathlessness and pain and fatigue. And ultimately, you want longer survival with the best quality of life that you can have. That is my wish for you. If you want that, please subscribe to the channel, follow along, ask me questions, but basically I'm just here to share with you my insights from, 20 plus years of working as a heart failure specialist and how I've achieved the very best results for many, many, many of my heart failure patients along with their journey, because we spend time addressing the things that they can do to help themselves. Thank you. I'll see you next time.